Hi, Dr. Michael Robinson, Doctor of Chiropractic, and I'm going to be explaining a little bit about back and low back pain and how to correct it and how to prevent it. So, common things I see that create low back pain in my clinic are tight hip flexors and weak core power. How does it occur? Well, if you're seated during the day, as many people are, 6 hours a day, your hip flexors are tight, right? You're right there. That angle is small. So what that means is that muscle group will tighten up over the course of the day. And when you go to stand up, as lots of my clients have told me, they'll go to stand up and they'll go like that. And that's that muscle being really tight and then pulling on it. Like if you imagine you walk around with your arm like this all day and then suddenly try and straighten it out, your elbow might have something to say about it. Well, same thing for low back. Sitting position is doubly bad because, well, it's actually triply bad. Because in addition to tightening your hip flexors, which run from basically front of your leg through your pelvis into the front of your lumbar spine, it also weakens your pelvic extensors, your glutes. So what that means is you adopt this sort of, over time, like old man posture. The triply bad part of that is that when they look at force load on lumbar discs, they basically sort of parsed out seated in good posture, seated in bad posture, standing in good posture, standing in bad posture. If you're seated with poor posture, which is to say flexed forward in a seated position, this is the maximal amount of compression that these lumbar discs can experience. And then the best is standing with solid posture, is the least amount of pressure on your lumbar discs. So the following exercises and stretches I'm going to be showing are going to be strengthening the core, stretching the hip flexors, strengthening the hip extensors, with the purpose of reducing your current low back pain or preventing injury or future low back pain.